Welcome back to Your Path to Wellness, the podcast where we explore health from a root cause perspective, giving you tools and insight to truly rejuvenate your body's natural systems. I'm Dr. Marian Constantinidis, and I'm your trail guide on this journey to better health. Today, I'm really excited to introduce to you one of the most transformative tools in my practice, muscle testing. For me, it's more than just a technique. It's a way of connecting with the body that's completely changed how I approach healthcare. It allows me to help people reclaim their lives in ways that once seemed absolutely impossible. As some of you may know, my journey into healthcare began with my service as a corpsman in the military. I was trained as an EMT and worked in battlefield medicine, and that's exactly where precision and certainty were everything. In the chaos of those situations, the tools that we had as corpsmen were the only things that kept us steady. After my military career, I transitioned into advanced diagnostics, really hoping to keep that certainty in medicine, but time and time again, I found myself at a crossroads where traditional medicine simply couldn't give answers to some of the most complex cases. Patients would come into my office after trying every option, often feeling hopeless and out of answers. When I began using muscle testing, it was as if a door opened that I never knew existed. Suddenly, I was discovering things that the medical model couldn't explain, things that had previously gone unnoticed or untreated. I watched patients get better who had been told there was no hope. Muscle testing has allowed me to see each patient as an individual and to engage with their unique health story in a way that's both intuitive for me and incredibly precise. So, what exactly is muscle testing? At its core, muscle testing, or applied kinesiology, is a technique used to evaluate the body's neuromuscular response to various stimuli, good or bad. By applying gentle pressure to a muscle, say an arm held out to the side, I can assess whether the muscle holds strong or weakens in response to that pressure. If the muscle holds firm, it's a sign that my body can adapt to that specific stressor. If it weakens, it tells us there's a vulnerability, an area that needs attention, a little bit more attuned attention. Now, I'll admit, some people think muscle testing sounds very unusual, and over the years, I've heard it all in described, from me being a witch doctor to alternative practice or voodoo, but here's the thing. People might be skeptical, yet when they've exhausted every single other options, they're willing to try something different. And that's how many patients find themselves in my clinic, looking for answers when traditional medicine hasn't been able to help them. So muscle testing works on two levels, okay? So neurological and frequency-based. Let's start with the neurological side of the house. The brain has a perfect map of the body, sort of this 3D image, which it allows it to see every single muscle, organ, and full system at all times in the body. This connection lets us determine if certain areas are functioning properly or if there's a disturbance. For example, I might test a point on your body, like one that corresponds with the liver. If the muscle weakens when I test that point, it's an indicator that there's an imbalance there. From there, I apply corrective techniques that restore strength to the muscle, which tells us that area is becoming more adaptable to the life stressors. That muscle test then provides this real-time feedback that's absolutely invaluable in guiding the treatment. One of my mentors, Dr. Alan Zadkin, always said, "Fix what you find." Muscle testing allows us to uncover root issues, focusing on what's truly causing the problem rather than just managing those symptoms. Now let's talk about frequency component of muscle testing. Everything in life operates on frequencies, including our bodies. When we interact with those frequencies through muscle testing, we gain insight into the body's adaptability on an energetic level. So imagine your body as a complex radio station with each organ and system operating on its own frequency. If something's out of balance, it's like a radio station that's gone completely to static. Muscle testing allows us to find that static, correct it, fully restoring harmony. This approach has been incredibly useful for cases that don't fit the conventional molds. Take, for example, a patient of mine. He's super athletic with a high-level government job. He came in struggling with unexplained fatigue, weight gain, recurring joint pain that was truly impacting his performance. After years of consulting various specialists, he was still without answers. Muscle testing allowed me to see that he was dealing with a combination of both physical and chemical imbalances. We were then able to identify specific dietary triggers causing that inflammation and stress patterns that had been adding to his body's load. By addressing these unique issues, we tailored his treatment plan to fit his specific needs, and his health began to turn around. So, how do we use muscle testing at Access Medical Center? A major part of it is addressing your structural, chemical, and emotional adaptability. Each of these areas contributes to your overall resilience, and muscle testing lets us determine where you need support. For structural issues, muscle testing helps us pinpoint misalignments or injuries. For chemical issues like food sensitivities or toxins, it reveals specific substances overloading your system. And for emotional adaptability, muscle testing highlights how unresolved stress or trauma might be impacting your physical health. It's truly a holistic approach that treats you as a whole person, not just a collection of symptoms. So this is a different approach from traditional medicine, which often relies on averages and statistics to determine treatments. But muscle testing allows us to approach each patient as an individual with unique needs. It removes the guesswork and assures that every single treatment plan is designed specifically for you. Now, I'll admit muscle testing has changed not only my clinical practice, but also how I make personal health decisions. I use a form of self-testing to make practical choices like which foods or supplements will support my body best at a given time. I know this sounds a bit unusual, but it's grounded in the same principles I apply in the clinic. It's a way of living in alignment with what my body needs in real time. So to wrap up, I hope that today's discussion has given you a new perspective on muscle testing. It's a tool that allows me to have a real conversation with your body, giving insights to your unique health needs and helping me guide you on a path to better adaptability and resilience. Thank you for joining me on your path to wellness. I'm Dr. Marian Constantinidis, your trail guide, and I look forward to exploring more about the incredible potential our bodies have to heal and thrive. Until next time, remember that true health begins with listening to what your body has to say. Thank you, and I'll see you next time. Bye.